Assalamu alaikum. In this video, we will dig out the anatomy of the middle ear. Middle ear extends from tympanic membrane laterally to the lateral wall of inner ear medially. It is divided into various parts. The portion of middle ear cavity that is just opposite to tympanic membrane is known as mesotympanum or antrum, while the portion just above the mesotympanum is known as epitympanum or attic. Hypotympanum is the portion lying below the level of pars tensa, while the protympanum is just anterior to mesotympanum. Coming towards the boundaries of the middle ear, just visualize that middle ear cavity is just like a box. It consists of roof that is continuous with the middle cranial cavity, the floor that is continuous with the facial region. Medially, it is continuous with the inner ear cavity. The lateral wall is basically the tympanic membrane and anterior and posterior wall. Now, starting with the roof is also known as the tegmented wall, a thin bone known as tegmen tympani. Basically, it is a petrous part of temporal bone that separates the roof of middle ear cavity from the middle cranial fossa. Now, the floor is also called jugular wall because here a thin bone separates the middle ear cavity from the jugular bulb of internal jugular vein. If this bone is congenitally absent in the children, then it causes the protrusion of jugular bulb in middle ear cavity, causing a disease condition called dehiscent jugular bulb. The lateral wall is also known as the membranous wall because most of its portion is formed by tympanic membrane. Some of the superior portion of this lateral wall is formed by the epitympanum recess. This lateral wall is semi-transparent, which basically helps us to see the middle ear cavity contents. Medial wall separates the middle ear cavity from the inner ear. It is also called labyrinth wall. There is a bulge on this wall because of the basal coil of cochlea of the inner ear. This bulge is known as the promontory. Along with the promontory, there are two windows. The first one is the round window. It is covered by a membrane known as secondary tympanic membrane or round window membrane. This membrane transfers the sound vibrations from middle ear cavity to the inner ear. Along with the round window, there is an oval window. This oval window is also called fenestra vestibuli. It is also covered with the membrane like the round window. It contains the foot plate for the attachment of stapes bone. So sound waves after striking the tympanic membrane reaches the oval window through ossicles and then enter the inner ear. Above the oval window, there is a canal for the facial nerve. If the bone is congenitally deficient, then the facial nerve gets exposed and the chances of its injuries increases. Above the nerve, there is a facial prominence of the lateral semicircular canal. There is a hook-like projection called processus cochleariformis. It basically acts as a pulley for the tendon of tensor tympani muscle attached to the head of the malleus. The next anterior wall is also called the carotid wall because it separates the middle ear cavity from the carotid canal. Carotid canal acts as a passageway for the internal carotid artery from the neck to the middle cranial fossa. There are two openings in the anterior wall. The upper opening is for tensor tympani muscle. Tensor tympani muscle enters the cavity through the anterior wall and after passing through processus cochleariformis which act as a pulley for this muscle gets attached with the handle of the malleus. The lower opening is the Eustachian tube. Eustachian tube connects the middle ear cavity with the nasal pharynx. When this tensor tympani muscle contracts, it decreases the transmission of sound in the middle ear cavity. Last one, posterior wall, is also called mastoid wall because it separates the middle ear cavity from the mastoid ear cells which are present posteriorly to the cavity. There is a bony projection on this wall known as the pyramid which provides the attachment of tendon of stapedius muscle. This stapedius muscle is attached to the neck of the stapes. Like the tensor tympani muscle, the contraction of the stapedius muscle slows the transmission of sound in the middle ear cavity. Behind the pyramid, facial nerve is present. There is a depression on the posterior wall known as the facial or posterior recess. Medially to this facial recess, facial nerve is passing, while laterally chorda tympani, a branch of facial nerve, is passing. This facial recess is so much important for surgical point of view because it provides the direct access to the middle ear. As you have seen that the middle ear cavity is connected with the nose with the help of Eustachian tube. In the same way, the mastoid ear cells is connected with the middle ear cavity with the help of an air space known as the eardrum. The opening of the eardrum is in the posterior wall called the adytus. This structure including middle ear, mastoid ear cells eardrum, auratus, and the Eustachian tube is called middle ear cleft. It is lined with the mucus and is filled with the air. This is the same mucus that lined the nasopharynx. It is important because it maintains the balance in pressure variation. That's all for today's video. See you in next one.